medis semakin hari semakin maju dalam mengembangkan metode pengobatannya. Salah satu terobosan baru dalam bidang pengobatan sendi dan tulang adalah di bahu menggunakan implan logam. Tidak seperti implan logam yang lain. Implan logam untuk sendi bahu ini lebih fleksibel sehingga memungkinkan pasiennya untuk menggerakkan bahu dengan lebih leluasa. Lalu seperti apa penjelasan dokter terkait metode pengobatan penggantian sendi bahu ini? Simak penjelasannya berikut ini.
So sometimes when people have joint arthritis, the bone is worn out, you need shoulder replacements. And the typical shoulder replacements are like this picture here. You know, the ball is replaced by this metal ball and the socket is replaced by this plastic socket. Nowadays, we have even more high-tech implants. This one, this is a stemless shoulder replacement. So you can see you don't need such a long metal implant going in. So this is more minimally invasive, less blood loss, easier for revision procedures next time. But the thing with this kind of shoulder replacement is that the rotator cuff muscles must work. If the rotator muscles are torn, or if they get an injury next time, then it won't be able to work and you'll still have a painful, non-functioning shoulder. That's why now, with the reverse shoulder replacement, it can work even without your rotator cuff muscles. So this bottom row is the reverse shoulder. Why is it called the reverse shoulder? Because you can see the ball and the socket is now the other way around. Now the ball is on the shoulder blade and the socket is on the arm. So how does it work? Well, it works because it changes the biomechanics of the shoulder joint. This is your normal shoulder here. Your center of rotation is here. So in a reverse shoulder, the center of rotation is moved down and inwards and down, so it's down here. And what happens is this big muscle, the deltoid, becomes stretched, more tension and more mechanical advantage. And now your deltoid can cause you to raise your arm. So your shoulder can still function even if you don't have a functioning rotator cuff.
Lantas, kondisi bahu yang seperti apa yang membutuhkan pengobatan metode penggantian bahu terbalik ini?
This reverse shoulder was first created for people with arthritis and rotator cuff tear. But the results were so good for that the indication just exploded. So now we do this RSA procedure for people with massive or irreparable rotator cuff tears. We use it for acute shoulder fractures in the elderly patients. We use it for any kind of revision surgery. Let's say if there's a failed fracture fixation or a failed joint replacement, the reverse shoulder can be used for the revision. It's used for people with rheumatoid arthritis. It can be used for people with very severe primary arthritis or with cuff tears in the primary arthritis. It's very useful for tumors of the shoulder. So now the patient can have limb salvage and can still have a functioning shoulder joint. And it can be used for all these chronic conditions after a fracture or instability or rotator cuff problems as a very reliable salvage option.